Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and joining me this episode I have Wendy Cohen from the Health Department, Lincoln Trail District Health Department. You're the Communicable Disease Director. And we also have Sandy Blair, who is a registered nurse infection preventionist with Heartland Memorial Health, and Ruth Belflower, registered nurse and infection preventionist with Heartland Memorial Health. And today our discussion is actually around Ebola, what you need to know. So we're going to start, I think, Ruth, and tell us a little bit about the background of Ebola.
Well, Ebola is not a new disease or virus. It was first discovered in 1976 in the Congo in West Africa. So it is 5 strains of a virus, but only 4 can cause human disease. And there are about 1,000 cases seen annually every year, but it's contained to the area of West Africa, typically, until now.
Now, Wendy, she's talking about different areas in Africa, and so there are certain countries that are actually affected more than others. Is that correct?
That's true. Those countries are Liberia is the one we hear the most about, Guinea, Sierra Leone, Senegal, and recently they took Nigeria off of that list because they've been Ebola-free for 42 days.
Okay. Now, Sandy, we're hearing an awful lot about travel, and because we're hearing, West Africa, what is the travel recommendations pretty much right now for the country?
We're screening people to see if they've traveled out of the United States within the last 21 days or 3 weeks.
So when we talk about travel and we talk about Kentucky, because of course here we are, in the heartland, what is the effect that is actually happening on Kentucky right now, Sandy?
Depending on what airports you fly into or out of, they are screening people at this point at designated airports to see if you have any fever. They're not going beyond that at this point.
Okay. Now, when we're talking about screening, I think that's very important too, because here we are representing a lot of different, in the collaboration with our healthcare organizations, the health department, and also the hospital. We're taking a very close look in what we can do as far as our prevention and protection for our community. So if I was to come into a healthcare organization, Sandy, what would actually happen, like in the hospital setting?
Well, the first point of contact is typically your person that's going to register you for your appointment, or if you're coming in with an acute illness, as an example, to the emergency department, you would still register typically. In doing so, at that point in time, you will be asked, have you or a family member traveled out of the United States within the last 21 days? If that answer is no, then you would proceed with registration as you normally would. If that answer would be yes, then you would be screened further.
Okay, now I'm hearing 21 days, so it must be a lucky number there, or somewhere around that 21 days that's a little bit more of a pinpoint. So tell us about why we're honing in a little bit more on that 21 days type issue.
So the 21 days comes from this term called an incubation period, which is essentially the time from which a person becomes infected with a disease or with the virus until they develop symptoms. And it's been identified that the longest amount of time that it takes for an infected person to show signs or symptoms of Ebola is 21 days. That's the longest time frame, and so that is where the 21 days comes from.
Okay, we've heard like 14 to 21 days, right?
That's
some are typical.
Well, the average time that it takes someone to show symptoms is actually 9 to 11 days, but the course of the disease, once symptoms show, is between 14 and 21 days.
So let's talk about infection here, Wendy. And so with that, when does a person actually become infected and spread the Ebola?
Well, once they've come in contact with Ebola, like Ruth talked about with the incubation period, you can start showing symptoms of Ebola. You can become infected immediately, but you aren't infectious until you show symptoms. And typically 2 to 21 days. So that's where that 21 days comes from, is when you can start showing symptoms. If you haven't shown any symptoms within 21 days, you're declared Ebola-free.
All right. What are typical symptoms that we might see?
Oh, typical symptoms. In our area, they're very much flu-like. We have fever. Fever is one of the #1 symptoms we see. Usually a sudden onset of fever, headaches, muscle or joint pain, fatigue or weakness, and those are usually followed by vomiting, diarrhea, stomach pain, inability to eat, coughing, trouble breathing, and sometimes bleeding, oftentimes showing up in their urine first.
Okay, so we're hearing those symptoms, but then also we want to combine that with the potential of travel or maybe being around another person caring for an individual that might have had Ebola or something along those lines to actually be a trigger for the potential for Ebola, correct?
Absolutely.
Now, when we're hearing the Ebola and the transmission, Ruth, how is it transferred?
So Ebola, for the most part, is transmitted through what we call, in public health, direct or indirect contact with an infectious body fluid. So for instance, if I come directly in contact with the fluid, then I can get the virus if I may have a cut in my hand. There has to be a break in the skin or in your mucous membrane. An indirect contact may be if I touch a contaminated surface, like a table or a doorknob. But it can also spread through droplets. They don't travel very far, less than 3 feet, but if someone were to sneeze or cough, they can be transmitted to other people if they then come in contact with an individual's eyes or nose or mouth.
Okay. To be clear, we're going to define a little bit what body fluids are. Sandy, you want to tell us a little bit more about body fluids and maybe a droplet definition here?
Sure. Body fluids in this instance literally are any fluid, meaning blood, urine, stool,
Vomit.
vomitus, saliva, sweat, semen, absolutely any fluid.
So that's really why we're seeing a lot of the protective gear, and I know you brought some here with us today, Ruth, and really what we're doing as far as taking that step to be prepared if we have individuals that might show signs and symptoms, have the traveling outsider caring for an individual, possibly, that they had come in contact with the Ebola. So tell us a little bit about that protective equipment, and we hear the word PPE. What does that mean, Ruth?
Okay. So PPE stands for personal protective equipment, as you've alluded to, and essentially CDC or the Centers for Disease Control just recently released new recommendations, which we are happy to report at HMH we were already ahead of and we're implementing for our preparations, but that absolutely no skin of any healthcare worker be exposed if they go into a room to care for this person. So in order to make sure there's no skin exposed, there's several pieces of equipment that we would use, and the key point is they all need to be waterproof so that if there are large amounts of body fluids or sprays or splashes, that they do not come in contact with the healthcare worker's skin. We have full body suits that are waterproof. We have gloves that are nitrile that cannot be penetrated by fluids. We also will be using hoods that completely cover the head and the neck, and they have a face shield in them, and as well as leg covers that are waterproof because they come above the knee. And we also have the gowns that will be an extra layer of protection over a waterproof full body suit.
So we're really taking every precaution as a community to not only care for our co-workers, the people that are going to be taking care of the individuals, but also for the individuals' loved ones that might be going through this process too. Now I understand some of the different precautions that are going on and I hear the word Center for Disease Control, we hear the World Health Organization, everybody's really on top of this and collaborating and working together. So not only do we have that personal protective equipment, but we have guidelines in place to make sure there's almost a buddy system in donning and doffing that we're hearing words. So Sandy, tell us a little bit about that.
Yes, we're developing a process that is strictly in line with the CDC's recommendations, where that there will be a buddy or a witness that will monitor how the personal protective equipment is applied, because there is a certain order in which that needs to be done. So that's referred to as donning, is the medical terminology, and then to doff the equipment or to remove it. that is the critical portion of where you need to be watched. And actually, the CDC, as well as many other entities of the same sort, require or recommending that that is done by your monitor. In other words, you do not remove anything until instructed to do so, because there is such a pathway that you need to follow to do that in order to stay safe. We will be utilizing bleach, which is completely capable of killing Ebola virus, and so that will be done within the steps of removing the PPE.
Okay, so we've really talked about a lot of different measures that are in place. We have the screening process that if you come to a facility, you're obviously asked those questions for your own protection and for others' protection. And that includes the travel, the signs and symptoms of the fever that we heard too. We have the preparedness as far as our personal protective equipment, the guidelines that are in place. What's really going on in the community, Wendy, as far as everybody working together? Because it's going to take a lot of different people that might come in contact.
It does. As they say, it takes a village. Public health officials, our planning and preparedness division, has always worked in Kentucky very closely with our healthcare partners to prepare for events such as Ebola or such as bioterrorism events and big healthcare outbreaks. We work very closely with the hospitals to make sure that they have plans in place, that they have the equipment they need, and that we practice those plans. We actually go in and do exercises to practice our plans to make sure that it works and to be able to learn from our mistakes so that they don't happen next time.
Excellent. Now, we've been talking about potential cases, and I know everybody's been watching national news with different. What actually, have we had any cases in Kentucky, Wendy?
No. In fact, the vast majority of Kentuckians are at extremely low risk or virtually no risk of contracting Ebola, because most of Kentuckians are not traveling to West Africa. Those that do travel to those affected areas are being screened and being watched after they come home. But those
individuals are just low risk because of the travel rate.
Exactly, and it has to be to those certain areas of West Africa that they're traveling to. So the vast majority of Kentuckians are at very, very, very low risk.
We've heard the words infectious and contagious. So Ruth kind of defined the difference between the two and really why there is the concern with Ebola.
Right. So it is important to be educated about these types of terms and know how diseases spread so that you can feel safe and prepare yourself. So a disease can be both contagious and have also an infectivity or be infectious. Contagious is the way in which it spreads or how easily it moves from person to person. Infectiousness is the amount of a virus or bacteria that it takes to actually cause disease. And Ebola is an example of a virus that's not highly contagious because it doesn't travel through the air. You can't just breathe on somebody and get it or whatever, or it can't be transmitted via food or water sources in the U.S. But it is highly infectious because it does take only a small amount of virus if you were to come in contact with some infected blood, per se, in a cut in your hand. It would just take a few particles of that virus to cause disease, where for other viruses it may take more of what we may term a viral load or more particles of a virus to cause disease.
And it does tend to stay I guess more prevalent on a surface, is that correct, longer than other viruses?
Well, it's actually not very hardy outside of the body when you compare it to other diseases. There haven't been many studies because it's a very hard virus to study because of its infectiousness. You have to be under very controlled laboratory settings, and that's just not the real world. And so the studies that have been done show that it can live up to months outside the body in fluid, but then the CDC has posted that 24 hours is erring on the high side of a virus living in a hospital environment.
Okay, so hearing that, Sandy, what can we do? We talked about hand washing before, but really tell us the importance of what we could do to prevent our likelihood.
Just completely a very basic thing, meticulous hand hygiene. And in order to perform that, plain soap and water is completely acceptable, as well as any alcohol-based hand rub are very appropriate for that type of thing. But it's just of the utmost importance that we clean our hands frequently.
Well, here we are also in the middle of flu season, so I will bring that up. As we know, we are really encouraging individuals to get the flu vaccine. Tell us the difference between Ebola and flu, and I don't want to equate the two, but really understand our likelihood of maybe coming in contact.
You would be at much higher risk of developing the flu than you will Ebola. And I will add that the flu kills many, many more people than each year. I'm thinking that we looked the statistics up, and it was around 37,000.
Yeah, it causes over 200,000 hospitalizations every year just in the U.S. and up to 36,000 deaths every year in the U.S.
So they really need to talk to their healthcare provider, and of course the CDC recommendations, even children, infants, adolescents, adults, and even in, as we age, we need to get the flu vaccine.
6 months and older.
Definitely.
Everyone.
Absolutely. So, and then back to, Ebola too, we definitely need to make sure that we know our risks if we are traveling in those areas, what we need to do. We need to know and be reassured that our community is really taking an active role in preparing for the likelihood, if that would happen here in our area, to make sure that we can care for those individuals, also care for our people that are taking care of those individuals also too. So we've got all this PPE over here, personal protective equipment, and we're really talking about making sure, again, with the CDC guidelines, that they are not exposed to any part of the skin, the mucous membranes, and being in contact, as we have heard before, and that's with the direct contact with body fluids, correct?
Mm-hmm. Yes.
Now, indirect contact, not so much?
No, indirect contact, it can certainly be spread.
Okay.
Because the virus can live on a surface for several hours if it's just virus, or up to months if it's in body fluids. Certainly, if you come into contact with a surface, not a person, but with the surface that's contaminated with virus, you can certainly become infected with Ebola.
So really what the community needs to know is that they may be screened at point of contact when they come into a health facility and asked questions if they have traveled. We're really looking at signs and symptoms, and again, that's for their own safety, for the others that are in that facility also. And then meticulous hand washing, we heard that. Be cautious about coming in contact with other bodily fluids, as we should always anyway, with all the other things that are, I guess, present in bodily fluids too that we might be coming in contact. And get a flu shot. Pretty much right now anyway, you need to get those to reduce your risk as far as coming in contact with the flu, and all age brackets need to get that too. So anything else, Ruth, that you'd like to add?
Well, I would reiterate about the travel. Travel is not restricted to those countries there, but CDC has several levels of preparedness for travel, and it's at a level 3, I believe, which just means that they are suggesting different things to protect yourself when you travel there. And as Sandy alluded to earlier, if you come into the country, right now CDC is focusing on 6 different states, you will be monitored for 21 days, and if you come into those airports, they're supposed to be reported to the health department, who are the ones that will be responsible for following and monitoring those individuals if they've come back from those countries. So they're doing a lot of federal efforts now to also protect those that are coming in, to ensure something doesn't occur like we had occur in early October.
And I think we had discussed that this is evolving, and we're learning more about it. It has been around for a while, but actually the potential of it being in the United States, and with our widespread travel that we have available right now too. We're really looking, and so we're seeing those guidelines change and keep on top, and how we can always better the quality of making sure that everybody's informed, everybody's prepared, and the care. Now, we haven't talked about the care of an Ebola patient. So, Sandy, really, what is the care for Ebola?
Well, there is no treatment at this point in time, or no particular vaccination that you can get for Ebola. So what is being done is supportive care. Because of all the fluids that you can lose at a given point in the disease process, many different labs are being monitored. Electrolyte replacement will be very important. Just fluid replacement in general will be very important. You would treat the fever, that kind of thing. So, very hydrated. So it's just supportive. We have, you also have to be very careful as far as how many people will go in and out of that room. You want to limit the amount of healthcare workers that would be involved in that patient's care. So we have plans in place for that as well.
So Sandy, you're really trying to minimize the contact with that patient and then the potential for the spread, correct?
Yes. You want to have just a minimal amount of people traveling in and out of that patient's room. So typically when a healthcare worker goes in, they're going to stay for a few hours. Depending on what part of the disease process you're in, if it's where the patient is decreasing, if you see them getting in a worse state of health, then you're going to be staying in there longer. Hence the PPE that has been chosen, because it's very comfortable. With the hood, there's actually air that flows into that and makes it very comfortable for the healthcare worker to be able to stay in that room longer. The care at this point is supportive only. There is no treatment in particular that you can offer that type of patient.
I think there's even measures in place for how they can communicate with their family members too. So we want to be very sensitive to the individual that is going through that process, and the family members that are concerned about their loved one that might have Ebola at that point in time too. So with the isolation, I understand there are ways that they can communicate back and forth, correct?
Yes, what we have looked into at our facility is we have the capability, for instance, to use a tablet type of device, and one in the room with the patient and one outside of the room where you can use FaceTime or Skyping. That way also that would decrease the number of providers even that have to go in that room. You can communicate with someone that's already in there to assess that patient or ask them particular questions. Also, that's an avenue for the patient to be able to communicate with their family, because there will be very restricted amount of people, to include family, that are allowed to go in that patient room.
So we're really hearing the supportive measures, which usually include the fluids, because again, they might be losing a lot of those. So you might hear the word IV fluids and different things that are there to help that individual. Probably maybe oxygen, I don't know too, if they're having trouble breathing, and those are usually supportive measures. Medication-wise, there really is no cure. However, I think, as we had talked about too, every day something is changing, and I know companies are looking at what they can do to see if there is some type of a vaccine, a cure, or medications down the road that might help treat those individuals too. So Ebola has been around. It is changing. We also heard, I think Ruth, you had mentioned, I think initially people think Ebola, that's one thing. There's actually 5 different types of viruses, correct?
Yes, ma'am. There are 5. Only 4 can cause disease in humans, though. And it's like the flu. There's the different strains of the flu as well. So it's important to note that it is similar to many other viruses that we see, and it has been around for a long time. It's just not well studied, because it needs to be done in a very controlled setting given the exposure and the risks for it.
So as we hear this, we've got to watch our travel, look at our own signs and symptoms and what we might have been exposed to. Know that, again, our community has taken a great effort in making sure that we are prepared and have different precautions, I guess I should say, ready to implement and care for the individuals that are caring for the potential person, and also our widespread possibility of our community too. Wendy, anything else you'd like to add from a public health standpoint?
I think the main thing is, hand washing is important with preventing any disease. As she said earlier, basic soap and water. Wash vigorously for 20 seconds, or sing the happy birthday song twice. Or the alcohol-based hand sanitizers if soap and water is not available. That's going to go towards preventing any disease. So that's important, not just in Ebola, but in flu prevention and those nasty stomach bugs we get, which are often viruses as well. And get your vaccinations. Keep your vaccinations up to date.
And I was thinking, Wendy, as you're saying that too, not bringing your hands up to your nose, your eyes, and your mouth, and that's such a hard thing to do.
And it is a hard thing to do, but that's oftentimes how we spread these viruses, is by touching a contaminated surface and then bringing our hands up to our nose, our mouth, rubbing our eyes, and boom, we get sick.
It's that subconscious type of actions that we have, but that's really how things are spread because we touch so many different things and forget that. Sandy, any other comments that you'd like to make?
Just again to reiterate, to wash your hands meticulously. If you do travel, just be aware of signs and symptoms to look out for.
And I think be prepared to be screened.
Oh yes,
because
absolutely.
Everybody's
and I think we'll
looking
see
at this.
that become more widespread as well.
I think in the future too.
Yes.
Ruth, anything else?
I would like to reiterate a comment that Wendy made earlier, that it does take a village. Not only are we at HMH collaborating with all of our public health authorities locally, at the state, and even nationally, we are working with other community partners such as our emergency management services and medical services for ambulance transportation, because these patients may call 911 to be brought to the hospital. We have to have a plan in place with those companies as well to receive the patients, or also to have patients transferred should they require a higher level of care. We can't forget the long-term care or the nursing home areas either, who could be affected by this. So there are just several community partners that we will work with, and it really does take every single part of our community to really be well prepared, and I feel like that we are all coming together and working very well.
Well, great. We really appreciate all that you all have done to help us get ready and always be on top, I think, of infectious and communicable disease type issues that can affect, I guess, our community in the long run. As we wrap up today, we've been talking about, different options as far as cures, treatments, and in Kentucky, really, where do we stand with the Ebola issue? Tell us a little bit about what's happening with Kentucky being on the edge for possible treatment options, Wendy.
Kentucky has been nationally recognized for our planning and preparedness functions in our state. But one thing that's kind of exciting with this is they're finding through the use of tobacco, they are able to produce a medication that can treat Ebola. We're on the forefront of that. We're not there yet, but they did have some success with using that product in the first healthcare workers that were brought back to the United States from West Africa for treatment. So that's happening, I think, in Owensboro, Kentucky now, working on a cure for Ebola.
So we're on the cutting edge here as we look at being prepared, but also how we can possibly help nationally and worldwide, potentially, with some cures and some treatments here, correct?
Yes.
That's exciting. For more information, we encourage you to go to www.hmh.net, www.ltdhd.ky.gov for the Lincoln Trail District Health Department. Emory is also a very good resource, I believe, Ruth had mentioned, the CDC website and the World Health Organization. We'd like to thank our guests again for being here today and sharing this important information with us, and hope you tune in next month for another important edition of Health in the Heartland.